I know that it's going to be a good day.
The salon offering extra TLC to those who need it.
Yeah, it would be better a world without smoking.
Paris takes the air out of cigarettes with a smoking ban. And whether celebrating the 4th of July or just having fun this summer, tips on how to stay safe with fireworks. Welcome to Eye on Health, where we focus on stories that affect your physical and mental well-being. I'm Bradley Blackburn. We begin with the Medicaid cuts that are part of President Trump's One Big Beautiful Bill. The Congressional Budget Office estimates millions of lower-income Americans will lose their health insurance over the next decade, and there will be a significant reduction in service. As Skylar Henry reports, states will have to do more with less, and patients may pay a price.
Bend your knees and jump! That was a great jump!
Each hop is no small feat for 6-year-old Kennedy Beaver.
You have gotten so much better.
Her mom, Marilyn, says she's been in therapy sessions like this at least 2 times a week.
Mom, I want to be mom.
Kennedy was diagnosed with Noonan syndrome. It's a genetic condition that stunts development.
For her, it's short stature, poor growth, low muscle tone. With that, we became eligible for something called the CAP-C waiver through Medicaid.
North Carolina's CAP-C program pays for most of the treatments and medications for children through age 20 who have significant medical needs.
You don't want to fill her tummy too fast.
If they didn't have CAP-C, the Beavers say they would be paying more than $4,000 a month, even with help from their private insurance.
This is our medication that without the Medicaid coverage would be $3,200 a month because our primary insurance has denied us.
With Republicans in Congress proposing major cuts to Medicaid funding in the so-called One Big Beautiful Bill Act, states including North Carolina could see more than 600,000 people lose their coverage.
The cuts being proposed at the federal level at some point affect the entire program.
Jade Ludlum is with North Carolina's Medicaid, overseeing more than 3 million people that receive benefits. State officials told us if federal funding falls short, the CAP-C program could be on the chopping block.
When you take $700 billion out of Medicaid nationally, there's no way to really do that without people losing coverage.
If you had an opportunity to speak with the lawmakers, what would you tell them?
So if you want to fix it, let's fix it. But it's not in cutting services, it's in fixing a healthcare system so that everybody in the country can get a level of care that meets their needs.
The Beavers fear they may have to go back to rationing Kennedy's treatment altogether. Skylar Henry, CBS News, Atlanta.
The Justice Department has charged more than 300 people with attempting to swindle Medicare and other government and private health insurance programs out of nearly $15 billion. The various schemes are covered in more than 270 federal and state cases that have been charged or unsealed over the past month.
Every fraudulent claim, every fake billing, every kickback scheme represents money taken directly from the pockets of American taxpayers.
Among those charged are 19 members of a transnational criminal organization who allegedly bought about 30 medical supply stores, then used them to submit $10 billion worth of bogus Medicare claims. Most of it was prevented, but the group collected 41 million taxpayer dollars from Medicare and 900 million from Medicare supplemental insurers. Federal investigators haven't said how much of that can be recovered, but they did say they're seizing assets in some of the cases.
This enforcement action involves the seizure of cash, as well as luxury vehicles and properties.
Officials estimate yearly health care fraud is between $100 and $300 billion. More than a dozen children have died this year after being left in a hot car. That's according to the organization Kids and Car Safety. During the last full week of June, when temperatures were above normal, 5 children died, including one kindergartner from Ohio. According to local police, he had been left in his mom's car for an extended period of time. The boy's teacher says it has been gut-wrenching for everyone.
He was one of the ones who would stand out. He told me he loved me every single day. I'll miss going to his school next year, seeing him at all of his events. I'm missing him at T-ball.
Kathy Wall, the director of Safe Kids Palm Beach County, says to remember the acronym ACT to ensure this doesn't happen.
A, avoid leaving your child unattended in a car, not even for a minute. C, create whatever reminder works best for you. Leave your purse, leave your briefcase, leave your laptop in the back seat, leave a shoe. and T is take action. If you see a child in a car, don't try to figure out how long they've been in the car. Call 911 immediately.
The first hot car death of the year typically happens as early as March, and experts say an outside temperature in the low 70s is enough to cause the internal temperature in cars to rise above 100 degrees. It's hard to believe, but France is now banning smoking in many public places, even outdoors. Smokers that light up in public could soon face steep fines. It's part of a push to create the country's first tobacco-free generation by 2032. Remy Inocencio is in Paris with the story.
It's official. In France, smoking is now banned at all beaches and parks. French authorities telling the public tobacco must disappear where there are children. And that includes outside every school. Parents agree.
Yes, I think it's very necessary.
Okay. Should there be even more restrictions on smoking?
Yes.
If you want to smoke, you just need to walk like 10 minutes, go to a place where there are no kids.
Do you smoke by chance?
Yeah, sometimes. But when I go to a bar or a restaurant, I go outside on the streets.
With 75,000 French dying from smoking each year, to today's French government, much of this hazy air belongs in the past, though not all. Some will still linger over France's beloved café terraces, the café terrasse, untouchable for now.
Would you say that café terraces are the last final frontier for the defense of smoking?
Definitely, yes. Yes, of course.
Catherine Quérard is president of France's National Restaurant and Hospitality Lobby.
But you are not a smoker, and yet you are defending smoking.
For me, it's a space of freedom. And for us, terrace is a relationships, socialization, and it's very important for us.
She also says it's important to France's identity and economy. But some accept more change may come.
Even as a smoker, I still understand that it would be better a world without smoking.
While others puff, frustrated about the future.
Look around you. Where are the kids? They are not here. Okay, so I am a smoker. Okay, I smoke because I'm stressed. It's part of the freedom that we enjoy in France.
Remy Inocencio, CBS News.
Hormone therapy to treat menopause symptoms can have significant benefits, and there's a new study reconsidering the risks it carries for breast cancer. The research published in Lancet Oncology found that women who received estrogen and progesterone were more likely to develop breast cancer than women who did not use hormone therapy. But women treated only with estrogen hormone therapy were 14% less likely to get breast cancer than those who did not use the treatment. The study included nearly 500,000 women around the world who started hormone therapy in their 40s or 50s.
This newer research is focused on what actually happens in real life.
Medical contributor Dr. Celine Gounder says a past study that presented more concerning data looked at older women. She recommends women talk to their doctor about the best treatment for menopause symptoms.
A lot of women think that you'll take estrogen and that's actually going to increase your risk of breast cancer. And that's not what we found in this study. And I think the really important takeaway here is that hormone replacement therapy can be very safe. It is effective. In fact, it is the most effective treatment for a lot of perimenopausal symptoms.
According to the American Cancer Society, about 13% of women in the U.S. will be diagnosed with breast cancer in their lifetimes. A unique program in some California emergency rooms is helping people struggling with opioid addiction take their first step to recovery. Danya Backus reports.
Andy is a success story for doctors at Olive View UCLA Medical Center in Los Angeles.
My life's just changed completely.
He came to this emergency department at the beginning of his sobriety when he felt the urge to use again.
I just wanted help because I knew that if I didn't get help, I was going to go back to the one drug that would make me feel comfortable and normal.
While in the ER, he was prescribed buprenorphine, which diminishes the effects of withdrawal symptoms and cravings. Despite its effectiveness, an estimated 87% of people with opioid use disorder are never prescribed any medication to help them fight their addiction.
Sometimes they just don't know where else to get help, and we're open 24/7.
Dr. Annette Decker authored a study looking at the success rate of emergency room clinicians prescribing buprenorphine in California. Findings show at least 1 in 3 patients fill a second prescription within 40 days. 1 in 9 end up on continuous treatment.
It's huge because this medication can save lives.
For addiction medicine in the past, patients would come into the ER and we'd pat them on the back and give them a list of detox centers and say, good luck.
Doctors Maureen McCullough and Kenneth Pedersen see the results firsthand. They helped start a statewide initiative for prescribing the medication in the ER.
And they can go from a cycle of being addicted to opioids and having their life be full of chaos to, within a matter of days, getting their life back together.
Which is what happened with Andy.
I could have gone back that night and just done fentanyl one more time. I could have possibly died.
He's now nearly 5 years sober and says a trip to this emergency department was a critical step in his recovery. Danya Backus, CBS News, Los Angeles.
Fireworks and summertime celebrations go hand in hand, but we know they also carry real risks. The Consumer Product Safety Commission says about 15% of fireworks-related injuries affect the eyes. Jared Hill has the story of how one woman's life was changed forever after lighting fireworks at home.
Lisa Dickerson sees the world much differently this 4th of July after a fireworks mishap about 5 years ago.
It can go bad really quick.
The mom was shooting bottle rockets with her family, but one malfunctioned, causing the others to tip over.
I actually thought it was done, and there was still one left on the ground, and it was on its side. So when I went to turn around, the last one came and hit me right in the face, right in the eye.
Despite multiple surgeries, Lisa lost vision in her right eye.
I can't see anything over here.
She developed a significant scarring on the surface of her eye to the point that she can't see through the eye anymore and is severely disfigured.
Dr. Aaron Shriver is one of the ophthalmologists who treated Lisa. A 2022 study by the University of Iowa Healthcare found there was a 4-fold increase in firework-related eye injuries in the years after they were legalized in Iowa in 2017.
After that first 4th of July, we actually had to call in residents who were on vacation. And we had a all hands on deck. Anyone who's in town, if you're on vacation or you're just in town, can you please come in because we need help in the emergency room.
Her tips to protect your eyes: keep a bucket of water and a fire extinguisher around. Also, be careful when investigating fireworks that don't go off. Wait at least 20 minutes, then soak the faulty firework in water for at least another 20 minutes before throwing it away. Finally, consider wearing protective goggles.
Even if you are careful, you can it's still a risk. It's a firework.
Lisa's more cautious since her incident and hopes others see her story and stay safe. Jared Hill, CBS News.
Coming up, how this golf clinic helps kids with heart defects. And we'll introduce you to a teen who invented a way to help himself and others with movement disorders. Welcome back. A group of kids who spend too much time in the hospital are getting a much-needed break from their treatment. Marielle Mose reports from Minnesota, where they're taking a swing at something new.
28 young heart patients from Minnesota Children's and M Health Fairview got out at Highland National Golf Course.
There you go.
For 11-year-old Luke Thiessen, it was a chance to take his mind off the hospital.
It's like kind of stressful sometimes to like constantly be thinking about it, like when we'll have next surgery. It helps me think about something else.
Congenital heart defects are actually the #1 birth defect, about 1 in 110 kids.
Spencer Timmel started Scratch Golf Camp for kids like his son Charlie, who needed open heart surgery at just 6 days old.
Some of these kids have challenges cardiovascularly or with full contact sports. So golf is an amazing outlet for them.
So they partnered with First Tee to bring this camp to the Twin Cities for the first time.
I'm not really into sports that much, so golf, though, is like one of the things that actually helps me do sports.
The hope is that these kids don't just learn to play golf for a day, but fall in love with the sport for life, and they're doing that by gifting them their own set of clubs.
I'm excited to get my own clubs because I'll probably go play golf with my dad at some places.
This camp is not only getting more kids playing golf, but it's connecting them with those who share similar stories of strength.
Just to know that you're not the only kid that has it.
Marielle Mose, CBS News, St. Paul, Minnesota.
Williams syndrome is a genetic disorder that affects thousands of kids across the country, impacting their physical and mental development. But there are just a handful of specialty centers to help those diagnosed. A new center has just opened at the University of Pennsylvania Hospital in Philadelphia. Stephanie Stahl spoke to the director, who has a deeply personal reason driving her mission.
This center is going to be life-changing.
It's Penn's new Armolino Center for Williams Syndrome, a rare genetic disorder.
For me, it is very personal.
Jocelyn Krebs is the director who'd been researching the disorder for decades, and then she had a child born with the condition.
An insane coincidence, because suddenly I went from a scientist who understood Williams syndrome very deeply in one way to a mom trying to figure out, what do you do with a kid that has these various challenges? I have a big surprise for you.
This is her son Rise, seeing the center for the first time.
See anyone you know on this wall?
Oh, that's me.
That's you.
It's an interactive wall with pictures and gadgets. And there's a sensory room with different lights and playful distractions to ease anxiety common for people with Williams syndrome.
If I use this, I can make a handprint.
Rise has intellectual disabilities, a primary symptom of Williams syndrome.
We have some issues with our bodies.
This center, in collaboration with Children's Hospital, will provide comprehensive care and research for adults and children with Williams syndrome that often comes with severe heart problems. And this.
Behavior that is very characteristic of Williams syndrome, sometimes called the cocktail party syndrome because of it, which is this incredible friendliness, hyper-sociability. And what it really is just a completely uninhibited social approach.
With the right kinds of early intervention, people with Williams are able to thrive. With balloons arriving for the grand opening, there's new hope for brighter futures for Rise and others with Williams syndrome. Stephanie Stahl, CBS News, Philadelphia.
It's estimated up to 10% of children with cerebral palsy are diagnosed with a type that inhibits balance and coordination. One teenager who has the condition helped create a first-of-its-kind FDA-cleared brace to help kids like him control tremors. Danya Backus has his story.
Since he was 9 years old, Dylan Law has had one wish.
If you had magic powers, what would you do?
My hand wouldn't shake.
Dylan has ataxic cerebral palsy, a condition that affects muscle movement and control.
I think I kind of knew my whole life that I was different.
All of his life, tremors have caused him to struggle with things like drinking, writing, and playing.
Over the years, you try all the different things. Weighted silverware. There was a watch. There were electrodes on his neck. There were wrist weights, anything that would try to hold the tremors more steady.
None of those things worked. Now at 17 years old, he says there's finally a device that gives him the magic powers he's always wanted, and he helped create it.
To be completely honest, I never grew up thinking, oh my gosh, I want to be an innovator.
It's called the Move D. The D stands for Dylan, a brace that helps minimize extremity tremors for people with movement disorders.
So it is providing resistance against the tremors.
Dr. Sharif Tarman is a pediatric neurologist at Children's Hospital Orange County.
That sensory input back over the triceps helps kind of tell the brain you don't need to shake so much, and oh, by the way, this is where your arm is in space.
For years, Dr. Tarman worked with a team of doctors, Dylan, his mother, and University of California Irvine biomedical engineer students to create the adjustable brace that can loosen or tighten based on fine or gross motor movements.
Yeah, that's way smoother.
The brace was designed for children, but also fits adults.
If you told my 9-year-old self that this project would be where it is now, I wouldn't believe you. This has changed my life.
And he's hoping this device does the same for others. Danya Backus, CBS News, Orange, California.
After the break, a Texas salon that's not taking shortcuts to help all kinds of customers. And allokelping, a new word for what scientists think these whales are doing to help one another. Welcome back. New research may show how many creatures can benefit from a healing touch. Whales in the North Pacific have been seen massaging each other by rubbing pieces of kelp between their bodies. In the findings published in the journal Current Biology, scientists found evidence it may have a health or hygiene function. Victoria Gill with our partners at the BBC has details.
A grandmother orca locked in a synchronized dance with her grandson. As these whales rub their bodies together, what's tricky to make out is the seaweed that they're using for this underwater massage. You can just about see it between them, a short tube of kelp.
They're then carrying it over to another whale and placing it on the back of another whale and giving each other, let's call it a kelp massage. They're using the kelp to rub between themselves, which we hypothesize is performing a role helping to maintain skin health and perhaps helping to maintain social bonds.
It's not yet clear if this behaviour is unique to this one special population of killer whales known as the southern residents. When we made a documentary about these animals and the scientists who study them off the Washington state coast back in 2017, the team was just about to start using drones to monitor them.
They're hunting together. Amazing.
That aerial view has transformed our insight into these animals' lives. And it allowed scientists to see this behaviour for the first time. They're calling it allokelping, using kelp as a tool to rub onto the skin of another whale in their family group. The researchers hope that this new, intimate insight into their lives will help highlight the importance of protecting the waters where they live, hunt, and often massage one another. Victoria Gill, BBC News.
For kids or adults with sensory issues, even everyday tasks can be challenging. Omar Villafranca shows us how one Texas salon is going the extra mile to make pampering possible for everyone.
Got your shoes off, you're ready.
When simple things are hard to do, it can be frustrating. For Ashley Velasquez,
take a little bit off the top.
That was taking her 4-year-old son Julian to the barbershop to get a haircut.
He doesn't like hair on his ears, and so we've always had to keep his hair short, or he would scratch until he would bleed.
Julian has a speech delay with sensory sensitivity issues. So the buzzing of hair clippers and the snipping sound of scissors near his ears could trigger what every parent dreads in public, a meltdown.
Mostly it was like kicking and scratching and yelling and screaming.
At Morgan's Salon in San Antonio, the haircuts are less stressful for Julian. The salon offers cuts, colors, and even cuticle work for special customers who need a little more time and TLC. Sensory triggers like loud noises from blow dryers or bright lights can be adjusted. Even the vibrations from the clippers, which can scare some customers, are slowly introduced.
I messed up your hair. There we go.
Salon manager Katrina Venzer Vargas says the customer's comfort level is as important as the haircut.
If they want to cut their hair up there in the waiting area, if they want to walk around and we follow them while they get their haircut, we've even had them playing in the sink with the water while we do a haircut.
The salon is the brainchild of retired businessman, philanthropist, and father Gordon Hartman. He draws his inspiration from his daughter, Morgan, who was born with cognitive and physical special needs.
And that's what we're all about here is inclusion. You can get a haircut here, I can get a haircut here, and so can anyone else, even with acute special needs.
I know we're not going to have a behavior. I know that it's going to be a good day.
For Julian, that means looking good. And for his mom, feeling good. Omar Villafranca, CBS News, San Antonio.
A sharp idea. That's Eye on Health for this week. I'm Bradley Blackburn. Thanks for joining us and be well.